I'm Greg Hill. I'm an orthopedic surgeon at UnityPoint Clinic, Fort Dodge, in partnership with CNOS. Today, we're going to talk about knee replacement. We're here in an exam room. This is where we would first meet during your appointment to go over your symptoms, look at your x-rays, and determine what treatment would be appropriate. In a normal knee, you have nice, smooth, articular surface that you walk on. In an arthritic knee, which is wear and tear, the cartilage breaks down and you get these areas of exposed bone, which are very painful. For the knee replacement that I use, it is engineered to have a single radius of curvature for a smooth rollback to give the most range of motion in the replacement. You have replacement of the thigh bone, the shin bone, and then the kneecap. In a traditional surgery, the quad tendon is cut so that it can be separated to expose the knee. In a quad sparing surgery, we pull the quad tendon off to the side, perform the knee replacement, and then close up so the quad tendon remains intact. This in turn leads to a quicker recovery and less pain after surgery. If a knee replacement is appropriate treatment, then we would further discuss the surgery, what to expect, and your recovery.
Here we are in the operating room. This is where we'll be performing your joint replacement surgery. Anesthesia will get you comfortable. Nursing staff will make sure that you're well positioned, and then we'll get underway. During knee replacement surgery, the quad sparing approach, or not cutting the quad tendon and pulling it off to the side, allows us to perform the surgery with minimal tissue injury. This affords for a faster recovery. Joint replacement surgery typically takes 2 hours, which includes the time of getting you in the room and positioned and getting you back out of the room to recovery. From recovery, you'll then go to the same day surgery and get ready for discharge home. Here we are in same day surgery. This is where you would come after you've recovered from surgery. With outpatient surgery, our goal is to have you up and walking within an hour after surgery and then discharged home shortly after. One of the advantages of the quad sparing approach is that you have the ability to walk in a more natural fashion right away. As part of the highly trained orthopedic team in Fort Dodge, we offer outpatient surgery so that you can recover in the comfort of your own home. Thank you for entrusting our high-quality orthopedic team at Fort Dodge with your care.